Good afternoon, everyone. I'm glad I don't have to say, let's give a nice round of applause for Melinda and Larry because you already did that. That's amazing. Isn't that amazing? That's what we need. I love that. The back of the room there. All right. So welcome, everyone. My name is Charlie Papillo. I'm the host of Travels with Charlie on WDEV. So great to see a wonderful turnout here today for the first annual Coming Together, a Substance Use Addiction Summit. There is hope. I can't, but we can. That's very important. We have a number of speakers here today. We'll get to them in just a moment. Just a couple of notes here. If you haven't seen the memorial wall that's outside in the pavilion, you should do that. If there's anyone you'd like to memorialize, you can go there. You can write their name down. And hopefully everyone's had an opportunity to visit all of the booths that are here today, do some networking. I've already done some of that myself. Just a great opportunity to do that. Some wonderful people out there all working and helping here. So wonderful for everyone to be here today. I do want to first and foremost thank the sponsors. and to make sure I didn't forget it, we put on a big sheet of paper here, because obviously this Substance Use Addiction Summit would not be happening without the help of the sponsors, and specifically to Frank Coffey and the Greater Burlington Industrial Corporation. Frank is a gold level sponsor. Would you please give him a nice round of applause in the Greater Burlington Industrial Corporation. Also, thanks to the Champlain Valley Expo. Thanks to my friend Jeff Bartley for helping all of this come together today. Fawn Montaigne Consultancy, an anonymous donor, Savita, Valley Vista, Granite Recovery Centers, Division of Substance Use Programs, and of course the Howard Center, Dominion Diagnostics, Recovery Vermont, and GW Tatro Construction. This event would not be happening without the help of those folks. So again, a nice round of applause for them. I feel like Joe Biden up here with my with my cards. Oh, okay, I won't go there. Our first speaker today, Dr. Mark Levine, Vermont's Commissioner of Health. Now, prior to his appointment by Governor Phil Scott, he was a professor of medicine at UVM, position that he still holds. He has also served as Vice Chair for Education in the Department of Medicine, as well as keeping us informed and aware during the pandemic. We thank him for that. Won't you please welcome and give him a nice round of applause, Dr. Mark Levine.
Good afternoon. I just have a few minutes of comments that I'd like to make for this really well-orchestrated and wonderful afternoon. So many of us now think about our lives as before the pandemic, after the pandemic. Unless you don't believe the pandemic is going on at all. Since it did obviously have such a profound effect on all of us. But don't worry, I'm not here to talk about COVID-19, but I would like to remind everyone of that pre-pandemic world, which really wasn't that long ago. Because it was a time that Vermont was making progress in one of our most important public health goals, slowing the rate of opioid-related deaths and saving lives. In 2019, we saw the first decrease in overdose deaths in 5 years, which I think was a true testament to the systems of care in our state, and of course, the efforts of our communities to reach people and get them into treatment. Amanda Jones of our Division of Substance Use Programs will provide you with our data and the challenges that follow in a few minutes. Tragically, we know what happened next, how COVID-19 quickly reversed those trends, as many faced isolation, anxiety, and other changes to their support systems. We faced new challenges in getting people the substance use prevention and treatment services they needed. But our work did not stop. We adapted. So much of today is dedicated to hope, education, and inspiration. I want to climb aboard that train and believe what I'm about to tell you supports all those aspirations. And I'm so delighted to help kick off this portion of the program, knowing those who follow me have documented so much wonderful and educational material in print or in film, or have transformed their own lives and literally given so much of their lives and time to helping others who seek everything embodied in that single and perhaps inadequate word, recovery. And we will learn about the interface of treatment and recovery and our criminal justice system, an important collaborative effort with the state. During even the darkest days of the pandemic, treatment, recovery, and harm reduction services stayed open, making telemedicine and virtual services available wherever possible. 100% of substance use disorder treatment providers remained open, including outpatient, residential, all those who provide medication for opioid use disorder. And most preventive services continued with little interruption. I'm grateful to the broad network of community and medical partners for their tireless efforts in making sure the services critical to saving lives were available. And we continue to expand services of all kinds and meet people where they're at. We know one of the best ways to save lives is through harm reduction, encouraging substances be used safely. Our work must continue to be responsive to changing needs, ensuring access to prevention, intervention, treatment, and recovery programs for opioids and all substances. One important resource, VT HelpLink, has been successfully connecting Vermonters to drug and alcohol support services since 2020. Whether you're seeking help for yourself or someone you care about, this free resource provides confidential, non-judgmental support and referrals to treatment, recovery, naloxone, and other harm reduction services. If you're not already familiar with this resource, please visit vthelplink.org. It has already made a difference in countless Vermonters' lives. A critical piece of our work together will also be to counteract the stigma that can, for too long a time, keep people with substance use disorder from seeking help that they need. Helping people understand that these disorders are medical conditions has been one of my major tasks through the past 5 years. Talking to countless audiences about brain chemistry and viewing substance use disorder in general as a chronic medical condition, not a moral weakness or lack of willpower. And encouraging everyone, and especially those who are employers or are in law enforcement, to remain non-judgmental and empathetic to those working through treatment and recovery. I really do believe we have begun to make substantial progress here, and pairing that with the power of peer recovery coaches and counselors to meet each person where they are and share lived experience has helped so many begin the long journey that recovery is, and to achieve their full potential in life. You can learn more about this topic at endaddictionstigmavt.com, endaddictionstigmavt.com. We still have a lot of work to do to bend the curve on substance use and overdoses, and I know both the governor and the legislature are committed to ensuring people have access to the services they need. I anticipate a very lively next legislative session. And we now have the additional benefit of monies beginning to flow into the state from opioid settlements and have a process to inform us on how to best spend these monies on evidence-based initiatives. And if you haven't been reading the news lately, the number of opioid settlements that impact Vermont, as well as many other nations in this country, continues to grow, which means millions and millions more dollars to our state for new initiatives. We've made progress before, and we can again. I do continue to have immense hope and know we will make a difference and find solutions together. Thank you.
You can see we didn't have a rehearsal. That's all right. Thank you, Doctor. A little taller than me, too, right? There we go. Our next speaker this afternoon, lead public health analyst for overdose and prescription monitoring data at the Vermont Department of Health. She holds an NPH in epidemiology from the University of Arizona and has been working as an epidemiologist in the state and local health departments for over 11 years. And obviously they put that word in there. They wanted to see if they could. I practiced that time and time, and I got it right. Won't you please welcome Amanda Jones.
I will not be singing. I do not think anybody could follow Melinda, in my opinion. How lovely was that? So I want to thank Brad and Melinda for inviting me here today. As I've said before, I'm a data analyst, which means we are behind the scenes. We're not often out in public, so this is a real treat for me. So today I'm going to talk about what is likely not a very happy topic, but it's probably why everyone does the work that you do. So like I said, I'm Amanda Jones. I work at the Department of Health in Division of Health Statistics and Informatics, which is a bunch of code words for nerds. So I'm like the chief nerd of overdose data. So really the purpose of overdose surveillance and data reports is to identify trends and guide overdose prevention efforts. I want to note that this is a data-driven approach, but we do not lose sight of the fact that these are human beings who have lost their life to overdose. I think we all know that overdose is a very serious issue in the United States. Nationally, not just in Vermont, overdoses have been increasing, and you can notice a particularly sharp increase during the COVID-19 pandemic. This increase is mostly driven by fentanyl, a synthetic opioid. However, there's also been a sharp increase of opioid overdoses involving stimulants, such as cocaine and amphetamine. Now, we really need to focus what's been happening among our population. Over the last 10 years, fatal opioid overdoses among Vermont residents have been generally increasing. There was a particularly sharp increase from 2019 to 2021, which are likely due to impacts of the COVID-19 pandemic. Compared to the 3-year average, 2019 to 2021, technically, fatal opioid overdoses are higher in 2022 in the first 6 months. However, it is looking very similar to what occurred last year just in 2021, so I'm hoping that we have a year of stability and not a year of increase. What are some important key points of fatal opioid overdoses in the year-to-date 2022? Almost all fatal opioid overdoses, 94% to be exact, involve fentanyl. Only 11% actually involved heroin. I just wanted to put that big emergency mark to really drive that point home. So where did those who died of a fatal opioid overdose live? In Essex County currently has the highest rate, followed by Windham and Orleans counties. And this is pretty true historically, where southern and rural Vermont counties have the highest rates. We like to use rates instead of hard numbers because that's a way that you can compare across populations for different population size. So what are some important demographics of those who died by fatal opioid overdoses in the first half of this year? Males have a higher rate than females. Individuals aged 30 to 39 have the highest rate compared to other age groups. And individuals who are white non-Hispanic actually have a higher rate than those who are Black, Indigenous, or a person of color. So what are some other data analyses that our team have been working on and completed recently? We just which will be hot off the press next week, so you're all getting a very exciting data preview, of repeat opioid overdose emergency department visits and the Social Autopsy Project, which was published last month on Overdose Awareness Day, August 31st. So a question that we've often asked among the team are how often are repeat opioid overdoses in the emergency department? The more non-fatal opioid overdoses someone has, they're more likely to lead to a fatal opioid overdose. However, the more someone shows up in the emergency department, it's also an opportunity of connection. So from 2018 to 2021, there were over 1,600 opioid overdose visits in Vermont emergency departments. Of those, about 15% had a repeat opioid overdose. And this graph is crazy, so just remember one thing. Of those who've had a repeat opioid overdose, a quarter of them happened within the same month. And an additional quarter happened within 3 months. Noting that this is likely, for those who are going to have a repeat, it's going to be back to back. So who and where are these individuals most likely to have an opioid overdose visit? Females are actually more likely than males to have a repeat opioid overdose emergency department visit. I note this because that's actually different than someone who's likely to show up in the ED is more likely to be male, but those who are going to show up multiple times are more likely to be a female. So it's actually different than what we expected. And Rutland County has a statistically higher rate of repeat opioid emergency department visits than any other county or the state. So another data analysis I have to include, because it's one of the pride and joys of the health department, is the Social Autopsy Project. It is a statewide data linking project where we link data sets for the sole purpose of identifying areas of intervention. So why did we decide? We really want to strengthen institutions' abilities to identify and aid those experiencing substance use disorder. So what happened to these individuals the years preceding the overdose? Did they interact with the state of Vermont agencies or services? And what factors were associated with the overdose? So we worked with the state police, Department of Corrections, Vermont's Health Access, the Department for Children and Families, and the Department of Mental Health. And we also worked with some internal data sets that we have in VDH, such as the statewide incident reporting network, which it's emergency medical service calls, controlled substance prescribing, and impaired driver rehabilitation program, which is a program if you lose your license, you have to go through to gain it. So where are there intervention points for individuals who die of a drug overdose? Literally everywhere. 85% of people who died of a drug overdose in 2020 interacted with Vermont State Police. 85% of them had at least one prescription for a controlled substance in the 6 years prior to their death. About 2/3 were actually enrolled in Medicaid in a year prior to their death. There was a lot of data in this report. It is over 80 pages long, which could be a lot to read. So if people are interested, I suggest checking out. And the first few pages actually has a summary and recommendations written by various Vermont commissioners. So highly recommend checking it out. So what are some general observations from the results? Often with these individuals, there's a history of substance use and mental health. There's a lot of prior EMS calls related to substance use or mental health. There's often a history of treatment or claims, medical claims. There is a fair amount of utilization of the impaired driver rehabilitation program, a lot of history of previous overdose, but really there's no one size fits all. So probably the question that everybody's asking, why is this important? What does this mean? What does data tell us? Why do we use it? Data identifies geographies and populations at risk of fatal opioid overdoses. Males between the ages of 50 are at higher risk. Southern and rural Vermont counties have disproportional high rates. Women and individuals from Rutland County are more likely to have an opioid overdose ED visit. It also can identify actual intervention points so we can prevent this from happening in the future. 99% of people who died in 2020 interacted with at least one state system, and almost 90% interacted with 3 or more agencies. So I just wanted to give a few examples of how we actually use this information. What is the point of doing data analysis if it's not going to be used to improve public health? So we call it data into action. So one program that just got started, we're doing an outreach program through EAP for construction workers. We found that construction workers are at disproportionate rate of fatal overdose. There is now supports for individuals, as I'm sure you've heard, leaving DOC custody, such as naloxone, treatment continuity, or recovery. There is incredible increased coordination with DCF and DMH, community distribution of harm reduction kits with naloxone. There's now DPS and EMS distribution of naloxone leave-behind kits after a non-fatal overdose. And we have some targeted overdose prevention and harm reduction trainings. So in case anybody is looking for these, all of these are published on the ADAP Data and Reports website, so please check them out. And thank you.
If you hear that horn, that means they liked you. How about one more time? Can we hear it? We'll be bringing our next speaker up in just a moment. Truly a testament. That was the Adult Teen Challenge Choir. How about it? So our next speaker has the privilege of having a nice warm-up act. Brett Ann Stansu is the author of Unstitched, My Journey to Understand Opioid Addiction and How People and Communities Can Heal. Her essays and fiction have appeared in the Rumpus, Vermont Literary Review, Green Mountain Review, and other publications. She's been a guest on Travels with Charlie, and a wonderful book. If you haven't read it, you should definitely get that. Won't you please welcome Brett Ann.
You can stand wherever you like.
I'll stand right here.
Done.
Thank you very much. Thank you so much. My name is Brett Stanchu, and I have to say that I just followed what is probably going to be my most favorite part of today. And my thanks to all of you for coming out today, and particularly thanks to the ensemble we just heard. For those of you who have not struggled with addiction, I'll just begin and say, I have now 100 months, and I remember when I thought I wouldn't have one day. So to all of you again, thank you for being here. I'm going to speak just very briefly. My book is Unstitched, and it's a book I thought I would never write. It's a book about addiction in Vermont. It's my second book. But what happened was this. A few years ago, I took a job in a one-room Vermont library just north of Montpelier. This is a very Vermont book, and it was a very Vermont library. It was a one-room space in Woodbury, Vermont. And at the time, in the story of my life, I was recently divorced, I was parenting 2 teenagers, and I was very focused on keeping my life together, and I really wanted to succeed at this job. And shortly after I took this job, I realized that somebody was breaking in after hours. And the reason I knew this was there was a very thick scent of cigarette smoke in the mornings in the library. And through the rumor mill, because this was a small town, I very quickly learned that the person who was breaking in lived nearby. He'd been doing this for a while, and it was rumored that he had an opioid addiction. And I found this to be a very credible and probably reliable story. And my reaction to this, to my shame now, I'll say, was rage, it was impatience, it was frustration. And I went to a lot of effort to try to keep him out of the library. I had my defenses up on every possible aspect. And eventually what happened is he committed suicide in a way that was tragic and devastating to his family, to the community, and it just rippled through the community. And the night that he died, I was called in and I drove home. It was January, it was so cold, it was 20 below zero. There was no school, the buses couldn't run. And I sat outside my house and looked through the windows at my daughters, and my 2 girls were in there and they were eating dinner. They were eating a chicken that I had cooked. And I made my life stop at that point. And before that, I had thought I would just keep on doing what I was doing. But that night, I asked myself really hard questions. I asked, what have I done and what am I doing? And Unstitched is the book that resulted from asking those questions that night. There's 2 themes that go through my book, and the first is my real desire to understand addiction, not just opioid addiction, but addiction in the little towns where I live. I really wanted to know what was going on because it was clear to me that I didn't. And I reach out to a number of people in the community, staff at the Hardwick Health Center, the local police chief. Christina Nolan spent time with me, and also people who were in recovery and families who were also involved in addiction. Don and Greg Tatro spent a lot of time talking to me. And of all the stories in my book, I will say that the stories of people in recovery and the Tatro stories are by far the strongest and the most meaningful to me, because they were all so incredibly self-reflective about their lives, but also about our community and how we got to this place. And the second theme that winds all through my book is my own struggle with addiction. And although I had been sober for a number of years by the time I took that job, I had never really looked profoundly at myself, and I'd never looked at the shame and the stigma and the secrets that I had allowed to carry around my life and that I then carried forward into the world. So Unstitched explores those questions in a very Vermont context. It asks questions about privilege, what it's like to lose privilege. I really explore the notion of disease and addiction as disease and how I misunderstood that. And also how we treat each other, both people we know and strangers who we never know. And at the very end of my book, I quote a line from Rumi. It's a very famous line from this poet. And the line is, "The wound is the place where light enters." And all through this book, I have this insatiable curiosity to understand what makes a life turn towards recovery and what makes a life turn towards healing. And I still have this fixation. But as I rewrote and rewrote, I realized that I was missing the deeper aspect here, that I had never really looked at the wounds in myself, how I saw myself as tarnished, and I had never really looked at the brokenness of the world around me and never fully embraced that. And when I allowed myself to do that, when I allowed myself to chip away at the shame and the stigma that I believed I should be using, I saw the world in a very different way. And so while the light is what brings us forward, it's also really acknowledging the wound that brings us forward too. And that, while it can be and is a very dark place, is also what allows us collectively to heal ourselves. Thank you for listening, and thank you for being here today.
Thank you, Brad Ann. We have two speakers coming up next. So let's first, all right, make some technical changes here. Go ahead. Let's put it right in the middle there. These folks. No, they're pretty tall. That's good right there. All right. Well, earlier this afternoon, you heard Melinda White singing up here. She's also co-producing this event. She's also a person in long-term recovery, as you heard. She hosts and produces Recovery Rockstar, a TV show aired through Northwest Access TV. She is an employee of the Howard Center and Turning Point recovery coach. Her passion for helping the community most vulnerable people is what keeps her committed to volunteer and service work, as well as strengthens her personal recovery. Thanks to her commitment and hard work, this event is happening today. And along with Melinda White, we have Chief Maurice Lamont of the St. Albans Police Department. Chief started his career in law enforcement in 1999 with the Vermont State Police. He retired in 2019 as a commander and is now with the St. Albans Police Department. And he's a little concerned that he might have to sing a song with Melinda, but that's up to you. I don't know. She already set that bar. Come on up, if you would, please, and let's give him a nice round of applause.
Hello, everybody. So public speaking is not my thing. That's what Melinda's doing, but I am here just to talk a little bit about the embedded programs we've had at the departments I've worked at and how successful they are, in large part because of the cooperating agencies in Melinda. Nobody can do anything on their own, right? I come from a professional agencies, both with the state police and St. Albans Police Department, that we have a job to do. We interact with people with mental health issues and substance abuse issues. We aren't experts, I recognize that, and I know that from doing this for almost 25 years. So what's the best thing we can do? Well, the best thing we can do is bring experts with us when we deal with these situations. So when I took over the barracks in St. Albans in 2015, we looked at getting an embedded crisis intervention specialist to come with us to scenes. We started that program in 2016. We were the first state police barracks in the state to get a person with us 40 hours a week that was assigned to the barracks and rode with us to calls involving mental health. It quickly became, within weeks, the best resource I've ever seen in my career. There was a male in that position at that time. He is still there, and he was quickly able to bring resources to people in crisis. And with that, many times, those people were also battling substance abuse issues. He was also able to talk to them about that and help them with some direction and who they could seek for help immediately. As a law enforcement professional, we were looking to de-escalate calls, but also spend less time on scenes and reduce repeat calls for service from the same person. We also brought Melinda into the works with that, and she brought in her skill set. We were bringing her into calls as they were happening, warrants as they were happening, rather than just handing out business cards like we had done for my previous 20-something years. This program has since grown. I was in front of the legislature a number of times, over and over and over again, as kind of the official, spokesman for state police for a long time, trying to get this program sold across the state. Funding's always the issue, right? And I'm happy to say, now every barracks in the state either has one or is in process of getting one after all these years. Fast forward, I retired there, got the chief spot in St. Albans after 2 weeks of being retired and realizing that wasn't for me. And we have it in the St. Albans PD. We have the same program going. It's just as successful. We have a female in the position. She's doing great, and we still utilize Melinda's services. And the idea is still the same. We want to go to people who are in crisis, whether it be mental health or substance abuse, and while we're dealing with that situation, we want to be able to offer immediate help and immediate resources. Because as we've found out, again, is that if you offer somebody a business card or a number to call, oftentimes it doesn't get followed through with. Again, these are the experts. I rely heavily on them, and it works out really well as a collaborative relationship. I don't keep great stats. That's not my thing. This isn't a stat program. There's no stats to show the success you have if you turn somebody's life around or help turn somebody's life around. All I can say is we have success story after success story of people come forward and talk to us and say, if I hadn't met, our Nick, who's with VSP, or Sam, who's with us, or Melinda, and you all know Melinda far better than I do, if their intervention hadn't helped when it did, they probably wouldn't be where they are now. So I just encourage everybody in here, it's inspiration for me to come here and do this. We did one earlier this year, and it's great meeting people and seeing the transformation and the work that you've done to get where you are, particularly the group was just in front of us, but it's also encouraging to see all the people that came in and put up booths, and everybody's here to help. And it's great, and that's why I started this job 20 years ago, but things changed for me in my 20 years, and I realized that mental health and substance abuse isn't going away, it's getting worse. And it's gotten worse through my career, and it's getting worse now. As Dr. Levine kind of pointed out, COVID didn't help any of this, and my empathy has grown, the stigma is gone, and my job in the last few years of my career at the state police, and my job through this time with St. Albans PD, as to push these positions more and more. And these type of events is how we push it. And I appreciate everybody coming to hear it today. And if there's ever any questions about how our program works, feel free to call the PD, because I'm on a soapbox all the time with this stuff. I'm trying to get pushed out at a local level. If you have any state reps out there, money, money, money. They need funding. Every agency should have this in their house. That's the only way it works.
Thank you so much, Chief. So my name is Melinda White. I'm a person in long-term recovery. What that means to me is I haven't had to use alcohol or drugs since December 28, 2011. It is the, thank you. It's the grace of God and people that loved me and took a chance on a wretch like me that I'm even alive right now. My interest in being up here today is to highlight the partnership with law enforcement. My recovery date is December 28th, but on December 5th of 2011, I woke up that morning extremely dope sick in withdrawal, which was not a new feeling for me. And I had made that promise I had made many times to myself. I'm not going to use my drug of choice today. I'm not going to use heroin. I'm not going to use opiates. I went to work and of course felt horrible, and on my lunch break decided it might not be a bad idea to go to a package store and get a bottle to try to deal with the symptoms. And of course, as we know, once you drink, judgment goes down, and I ended up at my dealer's house again and used excessively. My employer at the time didn't know that I had a history of substance use. I had been in residential inpatient programs for a combination of over a year and a half prior to that. So I decided to head home and nodded off and drove under a semi and totaled my car and was arrested for the 4th time for DUI. One thing that I remember is getting out of the car with all the smoke and airbags and whatnot, and eventually seeing a trooper and telling him, I'm a drug addict, I'm an alcoholic. And he said, I'm not accusing you of that, but I need to arrest you. And I said, no, I'm telling you that. That's what I am, and I need help. And it was baffling to me. I don't remember everything he said, but I remember how he made me feel. He was compassionate, and he was curious. He was sober curious. So when I was being processed, I was there for a couple hours because I had to get a ride. My car was obviously not working, and I had to be processed. And I talked to him at length and realized that he wanted to learn more about how to help people like me. So when I shifted my entire career focus and got into the field of working in treatment and recovery, that's been one of my passions. I also have an officer in the family, so there was that piece. You know, he didn't have the blessing of seeing somebody grow in their recovery, and I didn't have the blessing of meeting an officer that I didn't feel was after me. And interestingly enough, since I got in recovery and stopped breaking the law, they're not after me anymore. So he and I traveled the journey together. And that's when I had met Chief Lumoth, who was lieutenant at the commander at the St. Albans, Vermont State Police Station. And one thing that I've noticed over the last, gosh, we're going on 8-ish years probably now, 7, 8 years, is the difference between people who are ready to participate in treatment and recovery when I'm with them at the barracks versus when they get a business card. The follow through is amazing. And there's not enough time in this summit for me to go through all the stories, but 2 that I'll highlight from the VSP days. There was a methamphetamine sweep that was done, and I had the opportunity to connect with 15 people. One of the people from that, who was also one of the manufacturers, is one of the most amazing rock stars in our community in a 12-step program. He chose abstinence-based recovery. Another person that I met at the barracks, again, she was new to being arrested, had no idea how to get help, and instead of being faced with fear, we were connected, and she was able to get treatment and recovery, and she was just recently on my local TV show, Recovery Rockstar. She got in an MAT program, and that's what worked for her, and she's been successful since. Fast forward a little bit, when the St. Albans Police Department had called me to meet with them and an individual. He was no stranger to the barracks. He had been arrested in the past, but by being connected, making calls right there on the spot, and him finally having a level of willingness, he's a rock star in our community right now. He's leading a nonprofit with some of our most vulnerable individuals struggling with homelessness and addiction, and because of his personal experience with it, he's able to reach them and bring hope to them. So I just mentioned a few of these because the efficacy of having the teamwork of law enforcement and mental health and or substance use workers is critical in my mind. I would love to see embedded recovery coaches and mental health crisis workers in every single law enforcement organization, not just state police, which that is happening more and more now, and that's wonderful. We also need it in the PDs because that partnership is the only way that we're going to be able to truly give people the option of treatment and recovery at the time that they're going to be at their most willing. So I just want to kind of put that highlight and plug for the partnership between treatment, recovery, mental health workers, and law enforcement. And I thank you all so much for coming here. Thank you, Brad, for having the vision last year of this, and thank you, everybody, for showing up.
Thanks for staying with us, everyone. Again, let me just mention some of the sponsors specifically, because we do want to thank them for making this event happen. The gold level sponsor, Frank Coffey with the Greater Burlington Industrial Corporation. Again, thanks to Champlain Valley Expo, Fawn Montaigne Consultancy, anonymous donor, Savita, Valley Vista, Granite Recovery Centers, Division of Substance Use Programs, the Howard Center, Dominion Diagnostics, Recovery Vermont, and GW Tatro Construction. Continuing with our program, for 41 years, our next guest was a practicing pediatrician in St. Albans. For the last 11 of those years, he was taking care of kids addicted to opioids. In 2013, the film The Hungry Heart was released, providing an intimate look at the world of prescription drug addiction. Here to tell us more, won't you please welcome to the summit, Dr. Fred Holmes.
Linda, pay attention. So I'm a baby doctor what made a movie. I want to tell you a little bit about my experience, and the theme is the black man sitting in the waiting room. Remember that. So anyway, my first 4 years in practice trying to take care of kids addicted to opiates, this is a snapshot. I received 3,250 phone calls. I saw 200 patients who were addicted to opiates. 134 I treated. 80 I was treating currently when I compiled these statistics. The missing ones, 36% were in jail, 24% had relapsed, 21% went for care elsewhere, and 18% graduated. The average age of first use was 15.1 years. Average age of addiction was 16.5. First care was at 19.8 years for a duration of 3.3 years of use before they were seen. 32% were treating themselves with Suboxone off the street. 27% had an intimate relationship with probation and parole. And 51% were using somebody else's prescription, primarily old people. The cost of the visit, I shouldn't go there, but it's staggering when you add it together. Suboxone costs $9 on the street, $9 in a prescription, $20 on the street, and $100 in jail. So anyway, we set out to see what we could do about this, and I did it from October 23rd of 2006 to November 17th of 2012. I treated 133 kids for opiate addiction. At the end, 19% were successfully tapered off. 55% were transferred to other providers who are prescribing Suboxone in the community, and 26% had relapsed. 25 of the kids that had significant co-occurring mental health challenges. Now, of the ones that I saw, I don't know if I told you this, I did. Anyway, so the business about the black man in the waiting room. Halfway through this adventure, I met my good friend, Katie, who's now hiding 3 rows back, hoping I'm not going to mention her name. And our relationship has been extraordinarily complicated, to say the least. She was a patient of mine, treated with Suboxone. She overdosed and died. She was resuscitated. And I literally found Katie in an NCSS group home in southern St. Albans. Right, Kate? Yep, head shaking, yes. Are you going to come up here or not? Excuse me. Are you going to behave yourself? Nervous? So anyway, Katie became my patient again. Because of what she'd been through, her care was a good deal more complicated, and we patched together a series of services to support her. We found an excellent counselor to help her with her behavioral challenges after her death, and we started treating her with Suboxone again, right? And I did my doctor data thing, right? It's what doctors do. And Katie came up to me one day with a series of questions that she thought was far more appropriate. It's a true story. It's a little embarrassing, but and these questions all had to do with what it was like to be addicted to opiates, an experience I had not had, right? Are you going to tell them? No, I'm doing a good job. So anyway, we handed out all these questionnaires. We brought all of this data back, and Katie started all over again, took the original data, resubmitted it in a different format, and came out with a lot of data. But what she did is she succeeded in painting a picture of what it was like to be addicted to opiates, right? I saw what Katie had done and decided it was far too technical for me, but I took the same concept, and instead of asking specific questions by items in their life, I just asked the kids, what was it like to be addicted to opiates? And when that happened, the doors opened. We have a stack of stories, many 5 or 6 pages long, that thick. And when you read them, they tell you what it's like to be addicted to opiates as a child. Right? Correct? Are you going to say anything? Boo. All right. I do. Have I gotten it right so far?
Hi, I'm Katie. I'm a recovering alcoholic and addict. I talk a little funny, so I will try to go slowly and enunciate my words so you guys can understand me correctly. So what I found in conducting the surveys was that alcohol and drug use are coping mechanisms that 33% of the, 33 were the number of surveys that I first was originally handed to me, that we all had very traumatic events in common. And so I dug a little deeper. I wanted to know about these kids. I mean, why were we all like this? And I asked them simple questions like, are you on probation or parole? Are your parents divorced? Top drugs of choice, which are Oxycontin, marijuana, and crack cocaine. And I asked them, when did you start using narcotics? And they said between 9 and 19, with the majority starting at the age of 15. I asked, do your parents know about your drug use? And 29 said yes. And I asked, do your parents do drugs? And 11 said yes. I also asked them how long it would take for them to get drugs, and if they were willing to seek treatment and who they sought treatment through. And 4 were clients of NCSS and 17 were clients of Howard. So the resources that are here, we have them in the community. The help is here. What we don't have in this community is people or providers standing up and saying, hey, that very well is my child's best friend, or hey, that child that's having trouble sitting still, it's just like my child. And I want to really stress the fact that I don't have any kids, I have houseplants. Quiet. But the fact of the matter is, like I said before, alcohol and drug use are just the coping mechanisms. We need something more concrete as a community, especially in Vermont, to simply say, you know, you're a child, let me help you. I mean, just Suboxone is just a very, very small piece of the puzzle. And I think that in order, well, I know for me that in order for me to get off it and to live my life as I am now, I had to have a team. It wasn't just Fred. I mean, Fred just wrote the script. I had to have an amazing counselor who knew about addiction, and he did. And I had to have housing. It's a huge issue, not just here, but everywhere. I needed to have safe and stable housing, and I needed not to be treated like I had a mental illness because I talked funny, because that's the way I was treated until Fred got involved and said enough. You know? That good?
No, you stay here. So anyway, we put all this together, and Katie's survey comes back, and it is mind-boggling. And I thought, wait a minute, we're driving the conversation. We should just ask the question and let the kids drive the conversation, right? So we made a new questionnaire. And the question was, tell us about your experience with addiction. That was it. And we got back stories, handwritten, 4 or 5 pages long. We have 300, something like that, a staggering number of stories. And when you put them together, you realize for the first time that if the youngster has an opportunity to tell a story, you learn about what they're going through. If we ask them, it's our interpretation of what they're going through, and we don't learn what we need to know. So I put all this together, feeling quite proud of ourselves, and one day, my receptionist comes in, dear Jackie, and says, Fred, there's a black man sitting in the waiting room. I thought, you're kidding me, in northwestern Vermont? Anyway, I come out and there is this serene, professional, polite, consummate gentleman, black man, sitting in my waiting room, and it's lunchtime. So I bring him back to my little office. I call Katie. Katie comes right up, and we sit and have an amazing conversation with Dr. Charles Johnson of the Department of Education of the state of Vermont, who thought he was sitting in the NCSS waiting room and didn't realize it was mine. We have this conversation about telling stories, the stories in these amazing questionnaires we have just had filled. And he says, do you know Bess O'Brien? And we said, no, right? Anyway, we contacted Bess, we gave her the stack of stories, she took the ball, and you've now seen The Hungry Heart. Thank you very much.
I just want to ask you quickly before you leave, if people would like to see that film, Hungry Heart, where can they view it? KingdomCountyProductions.com. Check it out. Buy it. Thank you. Thank you both. Our next speaker this afternoon is a board-certified psychiatrist in addiction. Since graduating from the University of New England College of Osteopathic Medicine in 2010, she has been devoted to working in the field of addiction. As an osteopathic physician, she is committed to treating patients in a holistic manner that takes into consideration the state of each person's mind, body, and spirit. Won't you please welcome Dr. Suzanne White.
It's super cool to be here, and I'm really thankful to be invited by Melinda and Brad. And it's also really cool to be on this stage after Fred Holmes, because I think I have some of his patients. So that's cool. That's quite big shoes to fill. I have a little cheat sheet, but I'm really excited to have an audience and to tell a story, especially since Melinda just brought up curiosity. And my story is about curiosity as a fulcrum for healing. And it starts out with me being a kid, going to the store and buying comic books because I loved superheroes, and I loved all of them. Superman, Spider-Man, the Green Lantern, the Hulk, Batman, and of course, Wonder Woman. And as a kid, I also put my father in the superhero category based on his ability to hit a tennis ball clear over the house and being able to run a whole marathon. So it was really heavy, sort of sucko, when my superhero father was disappointed in me. The worst, when I had been guilty of some shenanigans and ended up being lectured about, responsibility, yuck. So what kid wants to endure an adult going on and on about responsibility? Not a one. No adults want that either. It was an adjustment to grow up and find out that my now nearly departed and beloved father had been entirely human all along. It was a surprise to learn how many times in his life he had not been that responsible himself. This made me curious, and curiosity is my superpower. But wait, you say, isn't this a summit about treating addiction? Like, where the heck am I going with all of this? And I hope you're curious about where I am going. And I'm going to digress a little more. Recently, I spoke to a healthy pregnant friend. Due to her age, she's considered a geriatric pregnant woman, and therefore her pregnancy is considered at risk. She's super excited to have this baby. She was really thrilled about the latest ultrasound. But she said, my experiences going to see the doctors leaves me feeling like something's wrong with me. I don't really like going. The words at risk and geriatric make me feel like someone I don't even recognize. And this is a youthful, heart-filled, delightful woman, and she didn't feel like she was seen as anything other than a list of problems. They missed her natural radiance, the way she lifts anyone who comes into contact with her. They missed the chance to see her, to understand the gift she is to the world. This missed connection is felt by the patient, and where an opportunity to heal is lost in medicine. Curiosity about the whole person opens the door to connection. This connection is where radical compassion grows. My earliest exposure to medicine was through another superhero, my surgeon grandfather, who reattached fingers and saved lives. He had all the answers. He quizzed us around the dinner table about things like the best way to protect an exposed nail bed that had been infected while we were eating turkey. He shared his love of his profession. Like my larger-than-life grandfather, I believed medicine had all the answers. But over the course of my medical training, I realized the medical profession, like my once superhero father, had tumbled from its pedestal to reveal itself as a system with many strengths, but nothing, besides a maple creamy, is ever perfect. On my first day of medical school, I was told that half of what I was to learn may later turn out to not be true. The trouble was, no one knew which half that was. So despite modern advances, new technologies and medicines, modern medicine has its flaws. In an honest moment at the end of his life, My surgeon grandfather bemoaned the direction medicine was headed. He was disappointed it was becoming less personal. Managed care pressures threatened to take the healing out of healthcare. Without curiosity about the other person in the room, there's no real connection. Without a real connection, there's less likelihood for compassion and healing. Just as a dead battery cannot jump itself, we charge only when connected. We are designed to need one another, especially when we are in trouble. So, now I'm going to get back to what I'm doing here, talking about addiction. If a pregnant woman can feel challenged when trying to get care, consider the challenges faced by patients with addiction. When they attempt to get pain or withdrawal symptoms treated, they might be called junkies, turned away coldly instead of helped. Fortunately, when I had the opportunity to shadow physicians treating addiction early in my career, most of the physicians and healthcare providers were doing their best. Thank God there are people like Fred Holmes. I saw people providing supportive and loving care. Unfortunately, I also saw others using punitive and shame-based tactics, labeling their patients as addicts or dirty, judging a category instead of seeing the individual beyond the addiction. Curiosity about the whole person opens the door to connection. Without connection, there is no compassion. The difference between a judging and a therapeutic approach is in the presence or absence of curiosity. Not a prurient curiosity, not like the Jerry Springer thing, but a genuine curiosity grounded in humanity. This is the beginning of a soul-to-soul level hello. After years as a medical director of outpatient addiction services, I cringe as I look back at some of the ways we historically responded as a profession to people with addiction, at how we lowered the doses of buprenorphine in response to use of drugs, required completion of lengthy outpatient programs prior to initiation on life-saving medication, penalized individuals without transportation for missing appointments in rural areas, or even kicked people out of programs due to their addiction, essentially abandoning them when they were most in need. I stand here right now and apologize for that. I know better now. Fortunately, many on the front lines of treating addiction were and remain curious. Genuinely curious about how to help, curious about who is in the room needing help, and finally, curious about what it means to heal. Genuine caregivers are curious how to make things better for patients, and then when they have made mistakes, they are curious about how to improve delivery of care. We now know to lower barriers to access, and curiosity continues to serve as a fulcrum for healing. Instead of paternal lectures on responsibility and stopping drugs, the more curious approach is to ask about what is working about drug use and what is not working so well. The curious approach is to learn about a client's gifts. Patients may be curious about what it would be like to live differently, preparing to change but not quite ready. And after years, it has been an honor to witness patients become curious about their own capacity for healing and who they are under the use. It all starts with curiosity. In the 7 years since I have returned to Vermont to treat addiction and support mental health, I have borne witness to miracles in transformation. Patients have moved from homelessness to purchasing their own homes. Entire families have stabilized. Individuals have gotten driver's licenses, GEDs, started businesses, helped their communities, have been accepted to colleges, won awards for work performance, stayed out of jail, turned down offers of free drugs offered by dealers on their doorsteps, and have gone on to support others in recovery. Curiosity is the spark that kindles the connection the writer Johann Hari speaks about so eloquently as the antidote for addiction. Curiosity doesn't intimidate, does not demand or create shame. It engenders healthy neutrality and is a companion to a more mindful approach to life. It is the seed of radical compassion. Curiosity is the first step on a path to healthier conversations, both externally and internally. If you are in the audience today and feel overwhelmed by drug use that is getting the best of you, I ask you to be curious about who you are without drugs and curious about reaching out for help. If you are worried about someone who is using, I ask you to be curious about how to best support this loved one, friend, or client with compassion. No matter who you are or what you are doing, I invite you to be curious about how to make room for true healing in your own life. I invite you to be curious about your best version of yourself. There may be a superhero there. Thank you.
Thank you, Dr. White. Our next speaker, as they all have, has a very interesting story. Tracy Hawk is the executive director of the Turning Point Center of Rutland. She's been doing that since 2015. Prior to this, she was a registered nurse who became addicted to prescription opiates, causing her to lose her nursing license. Her recovery began at the Turning Point Center. She later became a volunteer and eventually the director. She developed the Correctional Recovery Support Program at Marble Valley Regional Correctional Facility. She continues to provide safe, non-judgmental support to others, just like she was given when she began her journey. Won't you please welcome Tracy Hawk.
Good afternoon, everybody. As he said, I'm Tracy Houck. I'm a person in long-term recovery. I want to thank Brad and Melinda for putting this together and asking me to come and speak again. I kind of want to start with sharing a little bit about my story. I was a registered nurse for 29 years, well respected in my role, very reliable with work, it was great. I had a back injury. I had a herniated disc back in, I think it was the late 1990s, and that's when I got introduced to pain pills. I got prescribed. I worked for a family practitioner in Florida. That was when they would give you boxes of samples. The drug reps would send you boxes of Vicodin, hydrocodone. He'd be like, take these, and I took them. And I wasn't in a happy place in my marriage. And I found that at that point, I wanted to get a divorce, but I had a young child. Didn't want to be the one to cause a corruption in the family lifestyle, So I continued taking those pills because what happened to me was that it just numbed me out. So I could function, I could do my role, I didn't have to think about how I felt, and I didn't have to think about how unhappy I was. And then when I moved to Vermont, I had a period of time where I didn't take any. And I was okay, but things got a little worse in my life, and I didn't want to be that person again to cause an uproar in the household. So I was working for a primary care physician up here, and I ended up figuring out how I could phone in prescriptions for Vicodin for myself, and I did that. I did that for a few years, and I got caught with that. And the doctor that caught me was one that I had worked for a number of years, and he respected me. And when he called me about that, I, of course, lied immediately. But then the next day he called me and he had checked at the pharmacy and he found how many I had phoned in. But I knew in that moment that I had to admit it, right? I told him, I lied to you, I'm sorry, I got a problem. And then it was, ironically, at work. I was working at a nursing home and I got approached around that time about, right at the time I knew I was being investigated, I got approached about getting a promotion at the place that I was working at and to be a charge nurse. And actually I've been talking about this recently with other people, and it's about having a little integrity, and When they approached me about that, I could have easily said no. You know, I'm not interested, or I could have said yes, and I could have gone on and then let the chips fall where they may. But what I did is I said to them, I said, I'm being investigated for prescription fraud. I have an addiction to Vicodin. And it was a very humbling experience, and luckily they were not, you know, they were very understanding and they let me resign. But then it was the chaos. Okay, what do I tell my husband? What do I tell my daughter, who was 17 at that time? And my daughter and I are very close. And I wrote my husband a long letter. I didn't tell anybody. I pretended that I was going to work, telling my friends and family. I didn't go out in public because I didn't know where to go. I didn't want to be seen. I didn't want people to ask me, where are you working now? And I remember reaching out through my insurance company that I had at the time and asking them about help. And I had this counselor or somebody that called me periodically. I remember driving off in my car, sitting in a parking lot and just, sorry, it gets a little emotional. But I remember that feeling. I wasn't suicidal, but I should have known better. And if the ground could have opened up and swallowed me, I would have gone. Because I was so embarrassed and I was so ashamed, and I worked in the medical profession. Then I had to tell my daughter. And that was the hardest part, because here I'm trying to guide my daughter through high school and to try to keep her safe and not hang around with kids that party and use drugs. And lo and behold, the person she trusts the most has a drug addiction. And I said to her, it's funny, when I told her, she just sat there on the floor, she looked at me and she said, you know, that explains a lot of stuff. And I was just like, whoa. And my vow to her at that point was, I will do everything in my power to make you proud of me again, because I can imagine you're looking at me like you don't know me. And that was the beginning of my recovery, and I didn't know what to do, but I knew I had to do something. So through the nursing board, I had to get an alcohol and drug counselor. I talked to her on the phone before I met her in person. She suggested I go to a 12-step meeting. So I knew nothing about 12 steps, so I Googled it, and then I saw there was one at this place called Turning Point Center of Rutland. I have no idea where that is, but I knew it was down on State Street, which was a place that I didn't want to go after dark, because that's where the druggies and the addicts were, right? But I went. And they used to have Friday night dinners there, and then followed up with an NA meeting, and I walked in there scared to death. But what I was met with was no judgment, no why are you here, what brought you here, none of that. It was just, we're happy to see you, what's your name? My name's, it was great. So I continued going to those meetings. And then I started volunteering. I didn't know what I wanted to do for work. I had a conditional nursing, my license was suspended, then I got a conditional license, and I paid for all the drug tests that I had to do. And then in 2015, the previous director left. I had a part-time job there. She resigned, and the board asked me to step up. And that was not what my goal was. My goal was not to be the director of a recovery center or a nonprofit. It was to kind of go full circle. But there was very little staff at the time, very little funding. And if I didn't do it, the place would close. And I know what it gave me. And if I could give that to other people, it was well worth it. So I stepped up to the role. And over time, we've grown that center. And the thing I'm the most proudest of is the program that we started in 2016, where we started doing groups at the local correctional facility. We got volunteer status. We went in there. We did 2 recovery groups a week. And then the need grew. And all these groups were voluntary. It wasn't required for them to go. But people came. We'd had 25, 30 inmates that would be standing there in the room. And what they were looking for was just somebody that they could trust, right? And somebody that didn't judge them, didn't look at them as a felon and an addict, just as a human being, and not rehash what they did in the past, but where do you want to go from here? And how can we help you do that? And we finally got funding for that, and it really grew that program. And when COVID hit, it was horrible because we lost touch with all those people. We had like 30 people that signed up for individual recovery coaching. And I had coaches going up there a total of about 10, 12 hours a week to meet with these individuals. So we took to letter writing to the inmates that were getting coaching. And we've had a number of them that have been released. And we've helped them, during COVID, when we couldn't see them, they'd be released, we'd know when they were getting out, we connected with them. If they went into the Dismiss House program or whatever program we went in, we made contact. We made sure we were there. And there's a lot of them that are still engaged to this day. And we finally were able to get back in the jail in August, the beginning of August. And before we even stepped foot in the jail, the list for people that wanted recovery coaching was like 25 individuals right off the bat. But the trust and and I wish I could bring some of the guys with me today, but I didn't plan this short notice. But if you come to an event in Killington on October 18th, hopefully you will meet some. That feeling of being looked at as a human being, regardless of the mistakes that you make, poor choices that you make, and just trying to be helped and supported. And I know what it feels like when you're at that point when you've done stuff that you've been ashamed of and you're embarrassed and you hurt people in your family. It's a horrible feeling. And nobody beats up on themselves any more than we do when we go through that. They don't need people out there saying, you did this and you did that. They need people to say, how do you want to change? And since I've been director, I see so much generational substance use in families. The biggest thing, Tanya, my associate director, and I, we started doing those groups, and it's a male facility at Marble Valley. And there was nothing inappropriate that happened there. These people just really respected us for coming in there, and we're grateful. And I remember when we started doing the groups, there was a young guy in there, a little towhead, looked like he was about 14, had a brain injury from an ATV accident in his teens. And he started to share. He talked to us, and he told me that his parents got divorced when he was 9 or 10. His mother didn't use any substances. His father was a drug addict. So he lived with his mother. When he started smoking pot and drinking a little bit, the mother said, go live with your father. When he turned 14, on his 14th birthday, his father shot him up with fentanyl, or with heroin. What hit me at that moment was a 14-year-old boy, his father doing that, and you get your sense of value and you get your sense of self-worth from your parents a lot of times, right? Or the people that are role models in your life. And it hit me. I'm like, where does this young individual have any sense of self-worth, or what his value is, or what his potential is? If your own parent can shoot you up with heroin. And it just got to me. And then I just started really understanding that people don't know what they don't know. And if it was never modeled for them, you can't expect them to know how to do it. So those of us that have had some of that modeling, that healthy modeling, that role modeling, we need to help these people. We need to help them. They're somebody's brother, sister, mother, father. And that's why I love the work in the correctional program. And we need to have this in every one of the correctional facilities in Vermont. Nobody gets a chance if they don't have somebody believing in them or see some potential. And the strength that people have that go through substance use is amazing. They just need to be shown and supported to help learn how to channel that in a more positive way. And that they're worth something. Everybody's experience helps somebody else. And, I'm just so grateful for our program that we do down there, and I just wish we could go everywhere in the state to do it, but we can't. But thank you. I'm grateful to be here. I'm grateful to see everybody that's here in recovery. I don't care how long you have, but you are beautiful and you're worth it. Thank you.
Thank you, Tracy. I've had the honor of meeting our next speakers, the founders of Jenna's Promise. In 2019, after the tragic loss of their daughter to substance use disorder, they decided to build a recovery center in Johnson, Vermont that would help women struggling with substance abuse. Not just in recovery, but getting back into the workforce, something that is so much needed and often overlooked. Won't you please welcome Greg and Dawn Tatro, the founders of Jenna's Promise.
Well, I'm gonna start this damn timer because I could be here all day. We're very happy to be here. Thank you guys for putting this together. I think it's a great thing. The more we spread the word, the harder we work at this, the more people we're gonna help. I've got a few things that I've been thinking about, and you know, the first rehab we took Jenna to, we rode in a car and we dropped her off, and you know, she was there for 30 days, and I picked her up at the airport, and she looked just like $1 million, you know, and never forget that look on her face, and it was amazing. And I said, man, I'm glad this is over. You know, we got this now. She's cured. Well, man, was I wrong. And so there was many more rehabs, and you know, ups and downs and downs and ups, and you know, 6.5 years, it was hell. It was hell going through that for us. Looking back on it, it must have been hell for her too. I'm sure it was. And I remember another memory. She came to the house one time, active, and wanted money. And we wouldn't give her any because we knew she was just going to support her habit. And she left the house. And I looked at my wife and I said, who the hell was that? You know, who was that person? Because it wasn't our daughter. And then, February 15th, I found Jenna dead in my basement. I worked on her, gave her CPR, felt for a pulse, there wasn't any. That changed our life forever. So, you know, we went to at her funeral. Another memory. The casket was beside me, and I put my hand on that casket. And I prayed that she was okay. After we recovered a little bit, we figured out that, you know, something's got to change. You know, we can lay down or we can stand up and fight. And it didn't take us long to stand up and start fighting. And we do it because other families are living the same thing that we lived. And we wanted to change that. One of the last recoveries Jenna was in, or sober living, recovery housing, I'm sorry. She called her mom one day, and there was a girl there that had to leave because she didn't have the money to stay. And we'd spent a lot of money trying to help Jenna, and we said, you know, we really can't help everybody. And Jenna said, when I get out of here, Mom, we're going to go and raise money and spread the word and try to help people. And that's Jenna's promise. So, a promise we will keep. We've started Jenna's house, which is a place for meetings. AA meetings, NA meetings, all recovery meetings, speaker meetings, and family meetings, which I'm very proud of. Because if we can help the families, they can help their loved ones. So we're very proud of that. We started JP's Promising Goods, which is a surplus store where the residents in our program work and other people in recovery in the community. We're roasting our own coffee now. We have a person that does that, and the residents will also help with that. We're going to be opening a new coffee shop on Main Street in Johnson. Well, we've subbed out the bakery and the coffee shop under the conditions that they hire most of our residents to do the work. We've taken on quite a bit, and running a bakery cafe is really not up my alley, or Dawn's, I don't think. So we said, well, we better find somebody to run this darn thing. And also, we're working with another partner of ours, Carolyn, who is we're working on a medical facility in Johnson where there will be MAT treatment, hopefully a counselor, and actually the first vending machine for Narcan in the state of Vermont. And that'll be open 24/7. Carolyn and Dawn worked on that, and it really is unique. So, we see these folks come in, they're broken, give them a safe place to live and a safe place to work. And I think part of what we're missing here is a safe place to live. We talk to people in these recovery centers, and they can only do so much when that person goes away after the meetings and whatever and has no place safe to live. If they go back to the same place, they're probably going to use. So we recognized that with Jenna, because when she would come home, she'd run into the same people again, so the cycle would start over. So, we thought, let's start there. Right now we have 3 houses, 18 beds, 12 people in them now. We're waiting to staff up a little bit more for the other 6. It's quite a project, And so most of them are working. I think you got 4 in college now, 4 taking college classes, a couple full-time people working. People are working what they can at JP's Promising Goods in the coffee roasting, but it gives them hope. This is what we need. They need some hope. They need some reason to get out of bed, to get up, to go do something. And then they discover that, gosh, this feels pretty good. I can feel good about myself again, because as we've heard these other speakers say today, the shame, the guilt. Well, if you can get up and have something to do and people that care about you, it can change. We see these people grow. One person came to us, 14 months ago now, went through the program, and now she's going to get educated to come back and work for us. We said when we started this, if we save one person, it's going to be worth it. And I think we've accomplished that at this point. So Dawn's amazing with these folks, and I tell people I just build things and we keep going from there. But
I think one of the biggest things that it's so simple, but just talking about the girl that just hit 13 months, I said, well, what made you do it this time? Because she'd been 20 years. She said, because when I walked in, you said, I believe in you. And she says, I never heard that. So every time someone walks in, I make sure I say, we believe in you, and you can do this. And it's working. It really is. It's so great to see people getting 5, 6, a year, 2 years. And so just keep it, and we got a great team around us, so thank you.
we have another woman here, I think, somewhere. Where the heck's Carolyn and Haley? Hey, there she is. Haley, Dawn helped Haley get started. Can you stand up, Haley? 2 years. And she's our assistant manager at the store. She started like 2 of the meetings at Jenna's house, and her boyfriend is coming up on 2 years. It's pretty remarkable to see what I saw 2 years ago and what I'm looking at right now. Thank you, guys.
I've also had the honor of meeting our next speaker through a Travels with Charlie video, along with Greg and Don. Rick Welch, who also led the flash mob here. He's done that before for us, and give the flash mob a big hand, if you would, again, please. In 1977, Rick was desperate to change his life after years of drug and alcohol use. He found a new life and purpose at the Adult and Teen Challenge Center in New Haven, Connecticut. With over 25 years of recovery, he continues to help those seeking to find recovery for themselves. In 2003, he was appointed Senior Director of the first Adult Teen Challenge in Vermont. The Adult Teen Challenge Vermont Men's Center opened in 2005, and the Women's Home opened recently in 2019. Won't you please welcome Rick Welch from Adult Teen Challenge.
I'm going to set my timer also. Because when you're talking about recovery, and you're talking about people that are passionate about helping people and coming together in a venue like we see happening today, you could talk a long time about that. You know, I am a person in long-term recovery. In 1997, after losing everything in my life that addiction stole from me, I came to a point, I was homeless on the streets in New London, Connecticut, and I found my way to a program called Adult and Teen Challenge New Haven. After 16 different programs, 56 detoxes, I came to the end of my rope, which turned out to be a very good place to be, because it was at that point that I surrendered my life and I knew that I had to do something different. And there was a place that I could go that didn't judge me, that didn't call me a junkie, that welcomed me into the doors, that opened their arms wide to me, hugged me, loved me, prayed for me, and told me, like Dawn said, we believe in you. What an important part of helping folks and loving folks back to life as that one statement, that we believe in you, and you don't have to do this alone, and together we can do this, and together you get through. Now, when I walked into this building today and saw all of the booths, all of the tables, all of the resources, you know, you have to tell yourself, you know, thank you for being here. Thank you for having the passion to step up and to be willing to serve a community where many reject those folks. You know, I don't know, I've been in recovery for 25 years, and some of the most amazing, talented, loving, gifted people I have ever known are people in recovery. You know, Adult and Teen Challenge, we started here in Vermont. We opened our doors in 2005. That's almost 18 years we've been in existence. We've been helping men on our 10.5-acre piece of property with 3 buildings up in Johnson, Vermont. And now we have a women's home open in Hardwick. It's been open since 2019. We are a faith-based program, and we realize there's many pathways to recovery, and one size doesn't fit all, as long as we have all sizes available. And today, walking through the different tables and the different booths, we got educated, we got connected with some folks, and we'll be better when we leave here today than we were when we came in the door. So thanks to Brad and Melinda for just putting this together, and your hearts and your passion for helping folks with substance abuse is just so evident, and it's influential. So thank you so much. You know, we do take the approach that building people up, helping people to achieve is the best process to go forward in recovery. What we do at Adult and Teen Challenge Vermont, we apply biblical principles to our program, yes. We teach work ethics, yes. We give opportunity for people to learn skills. If they don't have a high school diploma or GED, we help them to get that and acquire that. We have many now that have come through our program and gone through and into higher education. Another thing that we do is all of our staff, all of our employees that work, we have 13 right now at the present moment between the men and the women's center, all have come up through the program. We say our best assets are in our dorm rooms. Because why? We believe in the people that we help. You know, recovery isn't an easy journey, and it's certainly not meant to be done alone. So we love people back to life. We look at them not as an addict, but as someone with so much potential. You know, we're a long-term residential program. Our program lasts from anywhere from 12 to 15 months. And then we have a component afterwards we call an apprenticeship, where they can learn everything and apply everything that they have gained through the last year to 15 months and enter into a place of leadership in our program where they get training, where they learn. You know, there was Vermont Recovery Coaching Academy. 4 of us went through that because, you know, we want to get better. And we're so glad that that door was open to us, that we could walk through that door and learn. We're way better off after we got through with that than we were before we entered in. And isn't that what it's all about? Is teaching each other, helping each other, gaining from each other, not in a dividing way, but in a way that we work together and come together to really make a difference in our communities. Really make a difference in the lives of those who come to us. The memorial board, you look at that board, and I have a few names on that board. I lost a younger brother to addiction 3 years ago. That anniversary is coming up at the end of October. And it's a very difficult thing to deal with. So when I got clean, when I got sober, when I started on my journey of recovery, I knew that there wasn't anything else that I'd rather do with my life than to help other people. And I thank God for the Tatros right down the street from us. Dawn and Greg, the work that you're doing is tremendous, and along with Tracy and everybody that is just putting their hands to the plow to make a difference in our communities and in our state. I like stories. I don't know if you like stories. I like stories. I like success stories. I like to hear, we call them testimonies, but they're really stories of what a life lived in recovery can produce, and the successes that we see through the men and the women of our program. I mean, over 18 years, we've graduated many that's gone on to do great things, and we continue to do that. We do have transitional housing at our facility also, and it's so important that they have a safe place to live. It's so important that they're getting trained in the workforce, that we place them and help them and set them up for success. I know that's what happened to me. That's how I succeeded, and that's what we need to do for others. So coming together, what a great event. Working together, what a great thing to do. And I'm looking forward to making more connections, and we're looking forward up on the hill in Johnson to be reaching out, to learning more, so we can get better, because together, we're better. We're better together than we are separate. So I brought a couple friends. Well, I brought a lot of friends today. You heard them sing, and you saw the signs, and you know, if you counted the months, I mean, I don't know if we added them up, but it was well, how many months was that? 1,755 months of like recovery was like singing in front of you today. and lives that have been absolutely changed and led in a different direction. So I brought a couple up here to just give a quick story, quick testimony. The first one I'm going to ask up is Wendy. Wendy, come on up, Wendy. Come on.
Hi, my name is Wendy. I've been in Teen Challenge 10 months, and I'm looking around, and everybody has these note cards and these like, oh, you don't have note cards? Well, you know, pieces of paper, and I have this sign, and it's blank on the back. If I had been smart, I would have wrote some stuff on the back of it I could have read, but I did not. So I'm standing with this blank piece of paper, and typically my mind goes blank when I'm up here in front of a microphone, but I realized that this isn't a blank piece of paper. This is my 10-month sign, and it's been really hard these last 10 months, but I've had this program to see me through. Let me thank all my sisters that prayed me up on stage today, because I didn't think I could do it. And before that, there were a lot of prayers that got me here. 11 months ago, before I got here, I was in a really dark place, and my life was headed in the wrong direction. I had to figure out something to do, and I had been to 30 and 60 and 90-day programs, and they had never worked. I needed something that was long-term. For reasons that we've heard before, I needed that extra support in the housing. The housing was huge. So I walked in the doors of Teen Challenge, and I didn't know what I was signing up for, but I'm glad I signed up. I've come to a faith that's so deep. I can thank a creator today for being alive, bringing me into recovery, and being here today. Thanks. Uh-oh, my mind just went blank. But no, so I now have clarity and perspective that I've never had before. I have the confidence that is incredible. Even though I'm a little shaky today, I can say that the confidence comes from the skills and the hobbies that I've learned while at Teen Challenge. Typically, you'll find me with a cutting board in hand, which is another reason I brought my sign up. I do an incredible amount of work at the wood shop, and this has really opened doors for me to be able to speak to people one-on-one and let them know that this is a program and resource that is available. I'm not sure that I have anything else to say. Good.
I do have a piece of paper. I came to Adult and Teen Challenge Vermont at the end of myself. I was going downhill fast. I'd spent so long lying to myself, and I knew that I needed direction. A childhood of abuse had left me hurt and hopeless, causing me to reject God at a young age. I blamed him for everything, until I decided it was just easier to pretend he didn't exist. Traumatic teen years and an adulthood of anger and bad choices left me broken physically, mentally, and emotionally. I needed to get back on track, but I had no idea where to start. I had decided that God didn't exist, but he never gave up on me. Just days after coming to Vermont, my life began to change. I saw a light here, and as I grow closer to that light, I grow closer to who I was meant to be. The things that I have learned here have helped me to begin fixing relationships with family and friends, given me a job that I love, brought me a few great brothers, and helped me to start healing the wounds of that early trauma. Even after 3 years of being here, 3 years of hope and love, 3 years without the psych meds the world told me I needed just to be normal. 3 years in the right place, I'm still learning and growing. As I look back at the changes in my life, I can't help but be grateful for this place of healing. Thank you.
Love those stories. Well, thank you for having us, and thank you for all that you do and the work that you do, and you know, together we're better, and it's just been a blessing to be here today. God bless you.
Thank you, Rick. Our final speaker today is a co-producer of the summit. First and foremost, he's a very good friend of mine. He's the executive producer and co-director of the video series Travels with Charlie, which we did about 40 videos. I still haven't forgiven him for that 90-degree day when they had me dressed in a metal full night suit. I had to climb a full set of stairs and then do an interview with somebody, but next time I'll read the fine print in the contract. He's also executive producer of the radio show Travels with Charlie on WDEV, as well as now guest hosting on WDEV on Vermont Viewpoint. He has produced and directed several videos on addiction and recovery. He has been involved in personal recovery himself for almost 19 years. He and his daughter Chelsea have a small farm in St. Albans where they raise sheep, and most recently, a litter of Norwegian elk hounds. I could say more about him. He's a great friend. Won't you please welcome the co-producer of this summit, Brad Ferlin.
Wow. So what a wonderful group of people here today. Wow. We thank everyone who has been involved in this event. Dr. Levine, thank you for being here and representing the state and all the service that you've given to the state. Amanda Jones, you brought the reality to it, and it's the hard numbers, but it's what we're working for. We want to bring those down. We don't want to put you out of a job, but we want to bring those numbers down. Brett Stanchu, thank you. Real world up in Hardwick, how that happens, how we realize that somebody is a human being and we have to look at them that way. Chief Lamoth, thank you. The whole premise of bringing law enforcement and recovery together is, it's got to be the wave of the future. Dr. Holmes, a pioneer in this. We thank you so much for everything you've done over the years. Dr. Suzanne White, wonderful, wonderful talk and inspiration. Tracy Hawk, you always make me cry. Greg and Don, you always make me cry too. Amazing stories. Rick Welch and Olive Teen Challenge and the choir director, amazing. Thank you so much for all of that. And it seems like I'm forgetting some, but Melinda White is a superhero. And this summit is so successful because of everything that she does and never sleeps. She has a cape, she runs into a telephone booth, she flies around and she gets things done, and she's just absolutely amazing. Charlie had mentioned our sponsors, and I will mention Frank Coffey with GBIC, whose daughter is up on the memory wall. He stepped forward being a gold sponsor. A number of other sponsors are listed around the event. We're so grateful for that because we couldn't do that without them. My own journey started when I was 8 and returned home to learn that my dad had committed suicide. And the emotions that I've heard today from several speakers are what was inside of me: the shame, alone, the emptiness, and really losing a guidebook for life. And when I could, I started drinking alcohol, and it became my medicine. It became the medication that I could not relieve the sadness, but I could bury it. I could put it away somewhere. But the problem with that is that you just can't put it away. You got to eventually deal with these things. And so today, what did we hope to achieve? And what I believe we did achieve. We're showing that addiction is people. It's loved ones. It's people we care about, people we love. And we wanted to make sure that the resources are there for them to get on a journey, a pathway to success. Find a way to get out of the pain of addiction. And what we saw today was, wow, there's a recovery center in every county in Vermont. The vets were here, the physicians were here, the law enforcement was here. We're bringing the puzzle pieces together. It's so important that we network out and we model things that can work. And when Tracy Hawk is doing amazing things in Rutland, we want it in every county in Vermont. We want every person in corrections to be able to find life, find hope, find love. We had the recovery wall, and we hope that it was cathartic to those who signed it. And we also value how there can be quick recovery, but we also need the workforce development. We need the jobs. We need the things that get people back on the road. And that is an amazing part of what all of this can be if we work together. Charlie mentioned, we have 10 sheep at home. We get up in the morning, we feed them at night. We get to walk on the road, my 13-year-old daughter and I. We get to see the sunrises and we get to see the sunsets. And I get to be a dad. So, there's an old Boy Scout song that we used to sing around the campfire. And I won't sing it to you because I don't want everybody running out of the room screaming. But I will tell you the lyrics. We're all together again, we're here, we're here. We're all together again, we're here. We don't know when we'll be together again. We're all together again, we're here. We lose a lot of people to addiction, that we know. Maybe today with the summit, we saved one life by our efforts. I hope that we have, and I hope that we've saved more. That will make this all worth it. We're all together again. We're here. I want to thank all of you for being part of this, and maybe we've saved one life. So thank you very much.